Tel Aviv for us at Sheba Medical Center, Israel's largest hospital. Everyone here watching with interest what's happening in Israel, Mark, and some interesting and potentially positive data coming out.
Yes, I mean, we've been reporting over the past few weeks the fact that because they've got real-world data now of how effective the vaccine is, they are beginning to trickle that out. They still don't have any peer-reviewed sets of data at the moment, but everything is looking in the right direction. The Pfizer jab upwards of 94% efficacy on a very large group of people that they are now looking at. So good news there. Throughout this pandemic, I think Israel has been ahead on the experience curve, if you like, both things that they've done well and things that they haven't done well. And this is a sign potentially of a problem ahead. Now, this is a vaccine centre and it's empty. The reason it's empty is because people are not coming in the numbers that they once were to get vaccinated. As they've trying to encourage younger people to get vaccinated, they are not quite so keen, either because they think that they are not going to be infected or because they have concerns about the vaccine. They've got issues as well with particular religious groups, the ultra-Orthodox Jewish community. They are a bit worried about the vaccine as well. So what the authorities here are now doing is taking these vaccine centres out of big hospitals and getting out into the community. I want to have a quick chat with one doctor here, Yaacov Lawrence, actually from the UK.
Indeed, from London originally.
From London originally, but you live here now. You're a cancer doctor, but I think, you know, one of the reasons we want to talk to you is you've got quite a unique perspective because you're ingrained in the health system here, but your parents are in the UK, so they are going through that health system. What lessons do you think we can learn in the UK from Israel?
Well, first of all, England's doing pretty well, so I don't think we should be too critical. You compare England to Europe, and England's doing a great job. So, having said that, you know, the rate of vaccination in Israel is leading the world. It's far higher than in England, and I think one of the things is the way the health system works here. So, of course,
you have 4 different health providers, don't you?
Indeed.
And they kind of compete against each other.
Exactly. It's a bit like having the NHS broken up into 4 smaller organisations. And as an Israeli citizen, I've got a right to sign up to any of those 4 funds. It's free of charge, it's all included in the taxation. But the health funds have an interest in attracting people. So there's actually a little bit of competition between those funds, and they've learnt to work in a very economic and efficient manner. And at the moment, they're competing with each other to give the vaccinations.
That's very interesting. And I've seen from my experience, it's going very well. They're now vaccinating anyone over the age of 16. But this place is pretty empty. I mean, you're having to get out into the communities now. There are certain communities. We know in the UK there's concern about the BAME community, ethnic minorities who are a bit worried. Here, it's the ultra-Orthodox communities.
I agree, and I think at the beginning of the pandemic we were a little bit simplistic. We talked about the R number, you know, how many people infected, as if the whole population is just one was one grouping. Whereas in reality, in Israel you've got the ultra-Orthodox, you've got the Arabs, you've got the Israelis, you've got the seculars, you've got all these different populations. In London, you've got the inner city, the outer city, the suburbs, and you've got to view these populations differently. You've got to relate to them. You need to outreach into those communities and really get, the vaccines to those people. Unfortunately, it's probably the same people who aren't listening to the stay-at-home orders are the same people who aren't getting vaccinated. It's a deeper social issue.
So what's the answer? You know, the health minister here is talking about telling people that if they haven't had their vaccine, they can't go to restaurants. They'll be asked to prove that they have had a vaccine to go out and enjoy themselves.
I think that's the way. You've got to make it worthwhile for people to get that vaccination. As it is in Israel, I think about 60% of the population are very motivated to get vaccinated. But there's about another 30 or 40% who don't want to get vaccinated. They can't be bothered. They've got other things in their life, and that's a challenge. Another challenge Israel is beginning to wake up to is children. What are we going to do with children? Children are not being vaccinated for the moment, and obviously that's going to be some kind of pull of infection that we're going to have to worry about.
Yeah, I mean, it's a political issue that I'm not going to ask you to comment on, but clearly in Israel there is a concern about the West Bank and in Gaza. I mean, these are communities, some of whom move into Israel proper, and yet they are not being vaccinated at a rate that others are here. So, that is a concern. How are your parents doing? Have they been vaccinated? In the UK, that is.
They've got their first dose. We're a bit disappointed they've only had 1 dose because that's a very controversial move the government made.
The suggestion is it's working, though. I mean, you know, we've talked to quite a lot of health professionals who do say that if you delay the second dose, then you are going to save more lives. I mean, yeah. I mean, do you agree or not?
Maybe. You know, I'm not an expert in infectious diseases, but I think partially immunized people could be a source of mutation. So it's a bit like having half a dose of antibiotics. So I'm a little concerned. I think that the studies were done with 2 doses, and that's what should be given to people.
Yeah. Well, Israel's got the advantage in that there are 9 million people here. Thank you very much indeed, Doctor. That's great. So there are 9 million people here, which means that they have got the ability to get that vaccine out there very quickly, and they are doing it. Just over 4 million at the moment, I think, have been vaccinated here. So in percentage terms, that is a very, very high number. I should say that, you know, the UK government has said that it believes that delaying the second dose will ultimately save more lives because they'll be able to get that first dose out there. But yeah, I think what's really interesting here is that Israel does appear to be ahead of the experience curve. It's not always good news, though. I was really struck this morning at how busy Tel Aviv was. They are still partially in a lockdown. One of the things that has been very interesting here is that people's ability to adhere to the lockdowns has actually been appalling, and that is why they've seen quick spikes again as they reduce the lockdowns.
Mark in Tel Aviv, thank you.